and you're good to go.
Perfect. Well, thank you everyone for joining us this morning or afternoon, depending on what time zone you're in. My name is Archana Sridhar, and I'm a primary care doctor at the San Francisco VA, which is an affiliate of UCSF. And I am thrilled to be able to spend the next hour or so chatting with you all about remediation. And my prior background in remediation is at my prior institution, I chaired our internal medicine residencies clinical competency committee and had the honor of thinking about this topic and working with both residents and students who have struggled in the past. And I will let Calvin introduce himself.
Thanks, Archana. Delighted to be with you all today. Calvin Chou, also an internist at the San Francisco VA and at UCSF. And have been also in the remediation space for quite some time, remediating folks at all different levels at UME, GME, and also in CPD. So happy to bring our expertise into this conversation. Let me just go to the next slide. Got some.
And I believe these are just the standard slides about the CME statements, as well as kind of a general overview of this talk in the context of the larger course on clinical education. So if you could advance, Calvin. And I'm not sure, Gary, if you wanted to chat a little bit about kind of these slides, or should we just move forward?
You can just move forward through them. This is just to let people know some of we've got an upcoming, the full series. The next year will be coming up in the fall, and then a third year after that.
This year, next year, and the year after that.
Yep.
Great. And so the content of this talk is drawn from this book. This is chapter 13 of the Remediation for Struggling Clerkship Learners. And this chapter was co-written by Calvin. So we're very lucky to have him there. And then if you could advance.
And then I need to do my disclosure here, which is you may have seen my name on one of these two books, one of which is very relevant to today's discussion, Remediation Medical Education. And just want to let everyone know that no proceeds from the book sales go to my own pocketbook. They go directly to the Academy of Communication and Healthcare. So it's June, right? It's never too early to buy to think about the holidays. Buy early and buy often. And there's a second edition of the remediation book that Adina Khaled and I are working on, hopefully to come out early 2023. We will be referring a little bit later to some of the competencies that are more deeply covered in that book. We're only going to be able to do so much in an hour, and there's a lot more detail in the book the book that's listed there, as well as a lot more updates coming in the book to come.
Great, thank you. And then, so this fully cognizant of the fact that this is a very, very large topic. And our hope today is really to pare down this topic to two particular learning objectives. And we're hopeful that by the end of this hour, you'll be able to sort of identify and describe kind of the major steps for the remediation of any learner who struggles. And then spend a little bit of time thinking through and describing the components of effective coaching and feedback, which are hallmarks of all effective remediation strategies to move learners. And wondering if folks can just keep themselves on mute if
oh, no, we're not anymore. Yeah.
Oops.
All right, so this is going to be our roadmap for this talk, and these are the steps of remediation, starting from identification all the way up to developing a learning plan, intervening, and then finally assessing a learner's progress. And we'll refer to this framework throughout the course of this talk. And then the size of the boxes tends to correspond with the amount of time the step will take in terms of this talk, and generally also in the course of remediation. So with that said, let's start with identification and invite you all to actually just type into the chat. How do struggling learners in your experience first come to your attention? And please feel free to kind of type in a letter or great. Great.
Looks like we've got mostly A's, some B's, some and fewer C's, D's, E's, and F's.
I do like that. Too late. Yeah, so I think that these are all sort of ways that struggling learners tend to come on the radar of clerkship directors or program directors. Failing a test, concerns raised by clinical supervisors, concerns raised by ancillary staff. It all sort of that's kind of the major ways these concerns are first identified. And I love the person who wrote "too late." And we can sort of move to the next slide. It's ideal to be able to identify these learners early on, just so that you have time to think about how you're going to approach that learner, and if remediation is indeed required, developing a remediation plan, because we all know that it can be time intensive. Of course, that should be balanced by not wanting to prematurely label a learner as sort of struggling or failing without acquiring all the details. And one approach that might be useful is if you're a clerkship director, during orientation, just sitting down with learners and sort of, mentioning that if they've had struggles in prior clerkships, that they can always reach out to you via email to set up a meeting to discuss that further, and that might help you support that learner a little bit early on. So that's generally the identification stage, and we can move on to the next slide. The real meat that comes after identification is clarification, because usually when a performance concern is raised, it's a little bit fuzzy and it's a little bit of a pixelated picture, and then the real work comes with trying to understand that a little bit more. And there, I sort of think about clarification, sorry, you can move back up, in three distinct distinct components, thinking through the learner and kind of, what might be going on with the learner that might be informing their performance. If the learning system or the learning climate isn't really optimized to support their learning, and then thinking about, is there a true competency area that requires remediation and requires intervention? So we'll move on and start with a little bit of a case. And this is a case that is drawn from my own practice. Jason's resident raised some concerns about him to a chief resident. During rounds yesterday, he kept losing his papers, mixing up patients. He couldn't be trusted to remember and recall crucial clinical data. His resident frequently has to take over his presentations on rounds and double check his work afterwards. And this is 6 months into Jason's clinical year, and his resident has some concerns. So you sit down and debrief with Jason. He tells you he isn't sleeping well, he has trouble organizing his day, and he's always had some problems with organization and focusing all his life, but it really hasn't been a problem until now. And then wondering if you can click, if there's like an animation. So wondering, take about a minute, and I would invite you all to sort of type into the chat what you think might be going on in this sort of scenario with Jason specifically. Things that could be informing his subpar performance. Sleep, love it. Okay, ADD, anxiety. Okay, perfect. I think we can stop there, because you guys all seem to kind of know what to do. So there could be a lot of personal, learner specific factors that can be contributing to Jason's performance. And I like to sort of group these into the 3 Ds. So the first D is distraction or deprivation. Is there something going on in Jason's personal life that is affecting his clinical performance? So lack of sleep, economic insecurity. Some learners struggle with lack of housing, and there's a lot going on the outside that's making it really hard for them to perform. Family illness. The other D is sort of depression or other mental illness, which is very common in healthcare professions. So anxiety, PTSD, and depression. And then with that, substance use disorder can also be contributory. And then the other D is differences in learning. So, somebody mentioned ADD. Does he have undiagnosed attention deficit disorder, dyslexia or dyscalculia, and then autism spectrum disorder can all be contributory. And so it's helpful to just sort of assess for any of these factors that might be contributing to a learner's performance. And you can advance the slide. And this is sort of how I've grouped that. Obviously, trying to assess for these factors will take some time and will take some rapport building with learners. And oftentimes with ADHD or ADD, in my experience, a lot of learners are able to compensate quite well in medical school. And then sometimes when they transition to a more rigorous or chaotic clinical environment, their normal mechanisms of compensation sort of, that get thrown out the window. It's really hard. They have to sort of relearn some strategies to keep themselves organized and throughout the day. So let's move on to a different case. This is Gina. I apologize. This is cut off a little bit. Gina's supervisor raises some concerns about her procedural competence, and she states that she was anxious, unsure, and unprepared when she supervised her last thoracentesis. You debrief with Gina, and she indicates that she's had fewer procedural opportunities compared to her peers during her intern year and feels less comfortable with performing procedures. Because her comfort level is less, she's avoided procedures, and she tells you, I guess I'm just not good at procedures. So invite you all to sort of type into the chat again. What are some other factors that could be contributory in this particular situation for this concern or this performance concern? Wow, imposter syndrome, bias. Wow, inadequate supervision. Great. Yeah, all of these things are sort of right on. Has our educational learning environment not been optimized to really support this learner in procedural competence? So is the identified concern not really a problem with the learner, but is it a problem with our clinical learning environment? And as educational leaders, do we need to intervene to make it more equitable? A lot of folks discussed, bias and sort of imposter syndrome. And these are all things that, clearly, exist and operate within our clinical learning environment. And so if you could click down to the next slide. These are sort of the sort of systems level contributors to a suboptimal trainee performance, including unfair labeling and stereotype threat, which essentially is internalized oppression, or when a trainee has sort of internalized the message that they don't belong. And then obviously implicit bias in a toxic learning environment. Or an understressed learning environment or an overstressed learning environment that's really contributing to suboptimal performance.
Archana, if I can add some things in the chat, some folks in the chat are talking about growth versus fixed mindset and thinking about the curricular factors that impede growth versus fixed mindset, and so the curricular factors that often support fixed mindset as opposed to growth.
Yeah, that's a really great point. Feeling like, I love that. So feeling like you have to get it. You're either good or you're not, rather than this is a journey and that you're here to acquire some skills and kind of move along that milestone trajectory. All right, and so after you've done this due diligence and tried to assess for both systems level and learner specific contributors to suboptimal performance, the next step in the clarification puzzle is to really get a lot of feedback to make sure that this concern can be corroborated, that it's just not one incident, but that we see sort of this performance concern across multiple domains, both inpatient, outpatient, learning conferences. In general, the best piece of feedback is direct observation of a learner's performance, which provides a lot of specific information to an observer about where a learner might be struggling. Global performance evaluations, which we tend to use a lot, tend to be not as helpful, primarily because they're biased a lot towards numeric data, which don't provide a lot of rich qualitative and narrative information about a learner's performance. So these are kind of the ranked order of multi-source feedback, although this is just sort of my, this is sort of, you know, in different situations, you know, certain feedback tools may be more effective and helpful to you than others. And so I like to think about the clarification step as sort of thinking about the identified concern as the tip of the iceberg, and that the three spokes are the systems level contributors, learner specific contributors, and then you know, whether there's an actual competency area deficiency requiring remediation. And if there is, then you can proceed to remediation. And so just briefly with the next slide, this was another example from my own practice. One of my colleagues called me one day and was really concerned because one of the interns that she was working with couldn't really come up with a differential diagnosis for chest pain when she was asked on rounds, and she felt like, you know, 6 months into her intern year, she should be able to do this. Obviously, some details and identifying information has been changed. And so if you can click again, so there were some systems level external contributors in this case. When I debriefed with the learner, she was pretty terrified of this particular attending and didn't feel safe, you know, taking academic risks, and didn't want to feel like she was wrong. There were some learner specific external contributors. She was the first person in her family to graduate college and medical school, and her father was just diagnosed with a medical illness, and she was taking a lot of time helping her family navigate the medical system. And then after you know, sourcing multi-source feedback, it did appear that there was actually a medical knowledge deficiency that required remediation. So this sort of helped create a more comprehensive picture of this particular learner.
And I might also add, Archana, if I could, that rarely as somebody comes up for remediation, is there a single thing? There's usually multiple things, just like with Agnes.
Yeah, absolutely.
You probably all know that.
All right. So the next step after you've done that sort of heavy lift of clarifying what the problem is actually developing a learning plan. And again, if you'll notice, step 5 assessment, you know, sort of is embedded in step 3 and proceeds along the course of remediation. And so, you know, it's helpful to you know, it's helpful at the outset of remediation to clearly describe and articulate what you're trying to do and how you're going to assess if you're going to meet your learning goals. And so next slide, please, Calvin. So these are the major components of an individualized learning plan that we often develop for learners who struggle. I'm going to start with you know, item number 2. I think ensuring that you have clearly articulated and SMART learning goals at the outset of remediation is really helpful. And as a reminder, SMART stands for specific, measurable, attainable, relevant, and time-bound, to make sure that there's some clarity about what we're trying to actually accomplish, is very helpful. And then the second piece, which I find really important, is ensuring that your assessment methods are defined pretty clearly at the outset of remediation, so that it's clear to all of the stakeholders involved in remediation what is going to be required of the learner and how the learner is going to be assessed at the end of remediation to determine whether they can be taken off of remediation or whether some other adjustment needs to be made in the plan. And then it's really important to have the learner involved in this process for the simple reason that they are adults, and adults are more likely to buy into and follow through with the plan that they are participatory in. So clearly this requires a lot of trust to develop during the remediation course with somebody who's an expert communicator and has expert relational skills. And the final piece of this is that once you've done this work, it's important to put it in writing and make sure everybody has a copy so that there's a shared mental model of remediation, how long it's going to proceed, and kind of what the goals are.
And in the chat, there's talk about what is expected of instructors. So it's not just what is expected of the learner. It's also what is expected of us as remediation coaches and what's expected of the institution. The third D, distraction, deprivation, difference in learning, and depression is the third one. Just yeah, mental health. There you go. There you go. Okay, next slide. They're answering their own chats. It's great.
Thank you. Yeah, and then this is just some examples of assessment tools that have been used for specific competency areas requiring remediation. So medical knowledge deficiencies are sort of kind of easily assessed by a test or an oral exam. Time management organization, we've used sort of focused observation and attestation by clinical supervisors. OSCEs and direct observation at the end of remediation can be helpful with a range of competency areas requiring remediation too. And then, you know, professionalism.
Oh, God.
Sorry?
Yeah. Sorry, I'm losing my, sorry.
Oh, no worries, we'll figure it out. So professionalism, again, is tough, I will acknowledge, but some methods that have been used are 360 evals, reflective writing, and sort of an assurance that no kind of lapses in professionalism have been seen, you know, after the end of the remediation period. Calvin, are you able to advance or, oh, yay. So this is an example of an individualized learning plan, and let's pretend that this is the individualized learning plan for Agnes. And you can see that sometimes the learner will articulate a learning goal, like I will improve my medical knowledge, or I will read more, which is quite vague, and it's hard to know what to do with that, especially because medicine is vast and immense, and it's incumbent upon the remediation coach to sort of think about and iteratively refine that learning goal with the learner to make it SMART. Again, specific, measurable, attainable, relevant, and time-bound. And so this is kind of a learning goal that I've used for learners who've struggled with medical knowledge, which is essentially around identifying and describing the presentation, diagnosis, management of common conditions, and then sort of listing out some diagnoses. And then here, the assessment in the very last column is kind of linked to the SMART goal, and, you know, making sure that they are able to attain a certain level of proficiency on a written test or oral test. And then you'll notice that the learning activity has not been mentioned yet. We've just sort of discussed the objective and the assessment, and the learning activity tends to flow organically from the objective and the assessment. So a learner could sort of think about, you know, if I want to achieve this goal, maybe I can divvy up this time during remediation and work on 10 diagnoses per week. And create, you know, structured notes about all of these particular features. And then at the same time, do about, you know, 15 to 20 practice questions, you know, in a self-regulated way. I find that sometimes the goal that once, you know, a learner is sort of identified as struggling, the tendency is to try to jump to the learning activity, you know, like, oh, this person is struggling, have them, you know, see this person. But it's really helpful and important to really specify what the goals are and the assessment methods beforehand. All right, let's move on. And that's exactly what I said. So the next step is around intervention. And now, you know, you've sort of laid all of the groundwork for remediation, and now is the time to actually work with the learner to help them achieve competence of their particular learning goals. And again, let's move to the next slide. Wanting to invite y'all to type into the chat again. Just curious to know, what are some educational strategies or learning activities that y'all have used in your practice for strugglers, for people who struggle? Simulation, very helpful. Great. Practice, tutors. Great. OSCE, preparation before presenting. Yeah. Test questions, reflection and coaching, mentoring and tutoring. Yeah, pairing with a great educator and coaching and feedback. Yeah, that's exactly right. And it's funny because I didn't ask you what strategies have you used for this particular competency area. I just sort of asked a general question about what strategies have you used. And I'm noticing just this theme of excellent feedback and excellent coaching and peer coaches as kind of universal themes in your responses. Great. So I wonder, are there things that I missed that Calvin, you saw in the chat? Okay.
I think they're pretty covered: formative assessment, self-quizzing, that sort of thing. Yeah.
Perfect. All right. So next slide, please. So these are, these are a lot of what you all have just included in the chat. A lot of peer-to-peer coaching, working through cases with and receiving feedback from another faculty coach. And then if you advance to the next slide, you'll notice that the themes are around effective feedback and coaching. And I think sort of the take home is that no matter what your educational strategy is or what your intervention is, one of the mainstays of effective remediation is ensuring that there is effective feedback and coaching embedded into this plan. And so it's useful to invest in faculty development around feedback and coaching so that this is done well, not only for your learners who struggle, but for all learners indeed. And so with that, we are lucky enough to have Calvin here, who is very practiced and at giving feedback. And so we are gonna do a little feedback demo with you all. And I'm wondering, Calvin, if you want to take yourself off mute and then sort of discuss, discuss kind of the setup.
Maybe I stop the share and then maybe I'll try to demo. Yes, we're up to that. So maybe I can try to pin you and me just so that we are showing that we're sort of exposed for everybody. That's me, and here's you. And so here we are as are we both on? Do you see me both? Okay, so this is a situation where this is a student who's coming to a clerkship director. I'll play just me. Let me see if I can spotlight for everyone. Yeah, I'm trying to do this. Add spotlight. It's supposed to be both of us there. Okay, so this is a situation where I'm a clerkship director. And this learner has been brought to my attention from a couple of attendings and maybe a resident or two for concerns about engagement. The student seems to be sometimes late to rounds and then is not findable during the afternoon when there's some work to be done. The student is nowhere to be found. And so this is enough has arisen a couple of times with a couple of attendings and a resident that it comes to the attention of the clerkship director, and the clerkship director is forced into this conversation. So I'm looking at, I'm not certain how to pronounce your name, Jagriti. You're saying we struggle with professionalism. Here we are. So let's say that we've set up a meeting with I've set up a meeting with the student, and the student comes to my Zoom office, and we're having a conversation. I'm just going to call you Archana, if that's okay. This is Archana Prime. It's not actually Archana, right? Archana is one of the most professional people I know. Archana, I really am appreciative for you coming into this meeting today. I know that when you're called in by the clerkship director, that it can feel a little unnerving. So I just want you to know that we're meeting today is to support you to succeed as best you possibly can. We do this with all of our students. I want to make certain that we are supporting you to the best ability.
Thank you. Thank you. I appreciate that.
So I wonder, first of all, if you have ideas about why you think I might be calling you in, if my email made any sense to you.
Honestly, I'm not really sure.
Okay, yeah, sometimes it can be very confusing, like, oh, I have to meet with Dr. Chou, the collective director. So maybe I'll just explain what the data I received are, and then I would love to hear your perspective of what's happening. Okay.
Okay.
So I got some feedback from a couple of the attendings that you've worked with, as well as a resident, that there are times that you have been late to rounds, and they're worried about that. And in addition to that, there are times when they're looking for you to do some teaching in the afternoon, and they can't find you. So I would love to hear your perspective about what's going on with you in either or both of those instances.
Oh yeah, I didn't realize that was like that was an issue. I have been working really hard. I've been pre-rounding before rounds, and it's hard to get all the data. And I remember there were a few times that I was on time to rounds, and everyone sort of came in late, and I didn't realize that anyone noticed if I was late to rounds. And then in the afternoons, I have a lot to do in terms of my shelf study, and I hear that that's one of the hardest tests. And I remember spending a lot of time in the afternoon, and nobody was really paying attention to me. So I figured I could just go home and just study, because that's sort of coming up, and I'm really worried about it. Yeah, I didn't even realize that was an issue for me to do that.
It's really important for me to hear your perspective, because some of these things are our fault. It sounds like that when you come into rounds you finish pre-rounds and you're ready to round, and then nobody's there, then it sends the message that maybe being on time is not important. And then it gets confusing between like different attendings having different expectations. And then there's this other thing where, the medical knowledge portion of our clerkship is emphasized in terms of the shelf exam, and you feel that you feel worried in terms of passing the exam.
Yeah, I think, yeah. I mean, I think that I know that my job is to pre-round and present, and then also do really well on the shelf. Okay.
So it sounds like those two are very important elements of the way that everybody interacts with us on this clerkship, as well as the clerkship itself. I'd like to, and perhaps I was less clear in the very beginning, and I want to make super explicit to you right now that those are two important elements, and we also are looking at a couple of other elements as well. One of them is learning patient care in real time. Oftentimes, as patient care happens during the course of the day, things happen, and we would love for you to be available for that, and then also learn not just the knowledge stuff, but also the management pieces, the interaction with team members as well as family members, and just engaging with the learning that emerges as time goes on. And I wonder, is that something that seems relevant to you?
Oh no, I definitely agree. I think, I just sort of thinking about the patients that I'm caring for, I think the learning is a lot more, it like sticks more, when I've seen the patient. So it's not just words on a textbook, it's words related to the care of my patient. Yeah, and I totally agree. I think I've just been feeling a little bit stressed out. And then also, really unclear about what my role is in the afternoon. And frankly, didn't realize that it was such a big deal to leave. Yeah.
Well, I'm glad that you agree with the relevance of learning in the context of patients, because that's the way I feel as well. I could do all the reading that I want, but then it doesn't stick until I actually see a patient with that. So I'm thinking that maybe helping you develop more of that relevant learning with actual patients, actually, maybe assigning another patient for you may be helpful so that you can actually expand your knowledge in a situated or relevant way, as opposed to just trying to learn stuff from a book. That would be something that I can definitely talk to your attendings about. And then the second thing is the messages, the implicit messages that your team is sending to you right now. That is something also that we can work on together. I'm wondering if there are ways that you can approach your team to increase that sense of engagement.
Yeah, I mean, I imagine, I could potentially be a little bit more proactive, especially, in the afternoons about, asking if there are opportunities or things that I need to be present for, and, potentially talking with my attending or my resident in the afternoon about what's the plan, essentially, so that I'm kind of more aware of what's expected of me. And then I suppose I need to ask to leave the hospital.
I think that would be helpful, just so that people can, it's not like people are wanting to know where you are every minute, but I think, as learning opportunities come up, I think they would like to share them with you. That in terms of the second point. In terms of the first point, I think it's really helpful to think about how you can be helpful to the team, and knowing that it's sometimes hard for a medical student who feels at the bottom of the totem pole to approach your attendings and residents. I would love for you to feel deputized to do that. That's our role, and I also will help grease the wheels there as well.
Okay.
I wonder, one final question for you, and that is that with the if you were the attending or resident, and like imagine you're in their role, and they're seeing that they're noticing, I want to get in touch with Archana, but I don't know how to get in touch with her. What you might think?
I guess I never really thought about it that way. I just imagined that the attendings and residents were so busy they weren't paying any attention. But it sounds like they are paying attention. Yeah, I imagine that they might feel like less willing to reach out to me if there was a learning opportunity, and yeah, they might just sort of, yeah, they might be less inclined to sort of teach me.
It's an unfortunate human thing that, if we can't reach the student, then we just make this assumption that they're not interested, and then there's a vicious cycle that happens. I would love to break that cycle for you, and I do think that some of these items that we've talked about, having you proactively go up to your supervisors and ask them about what opportunities there are, asking to leave. I will also help them by saying that I've had a conversation with you, and that actually you are working hard, and that you are eager to learn in a situated kind of way. I think those things will help a lot.
Thank you. I'll try to reach out a little bit more to my team, especially around the afternoon piece.
I wonder, just as we close, take-home points for you and how you're feeling right now.
I am a little bit surprised. Yeah, feeling, maybe a little bit, uncomfortable. I didn't realize that this was happening behind the scenes without my knowledge. But realizing that, probably I need to make some changes in my approach to the clerkship.
I appreciate your discomfort. Discomfort is really important for learning. And we will just chalk this up right now to a, you didn't know, we didn't make it clear. Let's, now that I hope things are clearer, that we can move forward. And I would love to check in with you another time, not as a punitive sort of thing, but just to check in to see how things are going in another week and a half. How does that sound to you?
Yeah, that sounds good.
Okay, I appreciate your time, Archana, and we have some clear next steps to move forward with.
Thank you.
All right, I'm unpinning us because I hate being on Spotlight. Remove Spotlight, and then let's get back to gallery view for everybody. And at this point, wanting to debrief with everyone, maybe writing some of your thoughts in the chat about what you noticed that I did in terms of this professionalism remediation. This was clearly not the entire conversation. This happened, I think, in 13 minutes, and we would have a whole half hour, probably would have delved much more into the clarification pieces, and would love to get a sense from you about what you noticed, what you thought, things you've tried in the past, as well as things that that maybe you think might not land, and if you have other approaches, this is the time for us to share some of our learning together.
Thank goodness.
Focused on behavior, had the learner reflect herself, trying not to be sarcastic. We can really go there easily, can't we? Oh yeah, Jeff noticed I was saying and not but. See, because look at my and, not at my but, right? Trying not to accuse, follow up with a meeting. Always with professionalism, Katie, exactly right, that in professionalism, there are multiple perspectives. And so part of professionalism remediation is understanding their perspective and then maybe guiding them toward, if you were in their position, what might you think? I mean, that expands the perspectives, and also is really important for patient care. So it's helpful from becoming a doctor perspective, as well as just being part of the team. Empathic. So this is revealing what's our thought, what our fault, what problems there are in the system, asking for a summary. These are all lovely. I would also be very open and welcome, actually need to hear, like, what would you do different? What would you have done differently? What are there other possibilities that you can see in this particular conversation? Forward thinking, follow up. Because I know that was not a perfect, this is not a perfect demonstration. There are I imagine that there are other things you have thought of that might be helpful.
I've got a question I'm going to throw at you too.
Go ahead, Gary.
Because Archana, you had mentioned documenting these times so that way there's agreement. And I like the way you guys handled it with just getting verbal agreement. How would you approach writing that up and making sure that the student or the learner has that, but then also that you've got a copy of it and documentation that occurred?
I think that's a really important point. Probably, rather than just ending with, I'm going to follow up with you, I'll probably say, would you write me an email with your take-home points? Just so that we can have, just that we can we'll both be clear about that. That way you have that automatic documentation.
Yeah.
It is legally reasonable for me also as the clerkship director to write down that we had this conversation on this date. This is what we discussed. These are the take-home points that we discussed. Those will legally stand up. I think it's much better if the student can say it, not just for documentation purposes, but also because that makes them accountable for themselves.
Yeah, would agree. And then I think, this is a feedback conversation for a learner who is in the throes of remediation. Sometimes it's helpful to document, the meeting with the coach. And I have done this as the coach and sort of sent an email like, this is my understanding of what we discussed today and sort of the next steps. And we're going to meet in about a week and a half. And these are the things that you articulated that you would discuss, and happy to, if I'm not getting anything right, please let me know, and we should rediscuss.
Some of the points that are coming up in the chat are terrific. Is she being ignored by the team? I didn't make that didn't ask that explicitly. I had the feeling that she was, but there is something about that. And space to study at the hospital. That's an LCME requirement. So you don't have to go. Don't go home. Like there's a specific study space.
Yeah.
Archana, I want to make certain you have time for the last bit here before.
Yeah, I will say as a student in that situation, it actually made me feel really good that you wanted to follow up with me, even though this was a simulated role play. Just knowing that there is support and that the feedback was not just to check a box, but also to help support a learner's growth was really it felt very nurturing.
Mm-hmm.
So thank you, Calvin, for your extraordinary abilities of empathy.
It's interesting how role plays kind of turn into real play sometimes, right?
Yeah. And so yeah, why don't we just chat? We're nearing the end of our session on remediation, and y'all have sort of thought about this before and sort of included these thoughts in the chat, but really the goal of an effective coaching relationship and a feedback relationship is getting a learner, and oftentimes learners who struggle have a fixed mindset. They feel like they have unchangeable qualities about themselves that make them prone to failure, and there is a lot of sort of externalization, which you might have picked up on in that scenario as well. Some of it might be very well-founded, and some of it might be a little bit more learner specific. And the goal is really to move these learners towards a growth mindset where they sort of acknowledge that that failure is natural and human, and it's an opportunity for us to sort of reflect, think, change our approach and strategy to sort of achieve greater success. And we'll move on to the next slide. And these are just essentially the take-home points for intervention. It's really incumbent to focus on effective feedback and coaching as far as faculty development for yourselves and for your institution. And y'all have included these thoughts in the chat, but formative assessment during the course of remediation is really helpful just to know, so that if your educational strategies are working and if your learner is on track to meeting the goals that you articulated at the beginning of remediation. And again, taking notes during each meeting with a struggling learner. Generally, when we're sitting down to do an individualized learning plan, I sort of make that expectation clear, like we need to be on the same page. And so I will sort of write down kind of what we discussed, just to make sure that we're reminded of that. And then ensure that there's transparency, that this ultimately might need to be shared with the arbiters of remediation as well, including the deans and clerkship directors. And then at the end of remediation, the summative assessment, which is sort of the final assessment of whether the learner has progressed, should be fairly straightforward if you've been doing formative assessment along the way. And then if you clearly define that summative assessment mechanism with your individualized learning plan in step 3. And so just last slide, I think. our almost last slide. This is Agnes's learning plan, and you'll recall that the summative assessment was clearly defined, and so making space for that assessment to occur will ensure that you have sort of met the goals that you sort of discussed at the beginning of remediation. So let's move on, I think, to the next section.
Maybe I could add one final bit about this last assessment piece. It's summative assessment of the learner, and it's also assessment of your entire remediation program. So given every case that you go through in terms of the success of your learners, how can our remediation program or remediation system be changed to make it better and better for our future, not just remediation students, but also for all students? Because really, ultimately, remediation is about the best education that we can bring. It's not just about remediating people, it's about education, period.
Yeah, that's a key point. This is a reflection of ourselves as educators too, in terms of our success.
Last slide, right?
All right, yeah, last slide. So these are the take homes and key summary points for remediation. We fully recognize it's a huge topic, but if anything, we invite you to sort of assess for underlying systems factors and personal factors that might be contributing to performance lapses. Ensure that you collaborate with learners. And set those learning goals and assessment methods before you dive into your learning activity. Really invest in positive and supportive feedback with a goal for coaching learners to move them towards greater competence. And then assessment is really helpful for you to determine whether you're doing an effective job. So thank you all for your attention and participation. I think we have about 6 minutes, and I know that there have been some questions in the chat.
Maybe I can just highlight, there were some suggestions about, the role play that we did earlier that are right on point. So, people ask, would you do this? And yes, that sounds great. So there's a lot of wisdom in the chat.
What would be an assessment for professionalism remediation? That is such a great question. And the evidence would suggest that professionalism can sometimes be the hardest competency or skill area to successfully remediate. And there are a wonderful amount of resources in Calvin's book on remediation for struggling learners that I have personally consulted. Learning activities for professionalism involve sort of reflective writing, having learners think about multiple perspectives. And if you'll notice during that role play, Calvin asked me the question, if you were your attending or your resident, what would you think of you? And having the learners sort of shift their perspective so that they can get, greater empathy for other people within the interprofessional team. 360-degree feedback evals are sometimes used for professionalism assessments. They can be effective, although, I think with professionalism, the goal is to ensure that there is sort of sustainability and that there are no lapses in professionalism during a certain point in the remediation period. Kelvin, invite your thoughts about that.
Yeah, all of those fully agree with reflective, really assessing reflective writing. And then there's a comment from John in the chat about assessing for internal locus of control for professionalism. Let me try that again. Professionalism examples, and there are some validated tools out there. Professionalism, narrative writing, and ways of approaching those narratives in a qualitative and validated assessment. That's the PIE is one of them, and that's those are delineated in the book. And I don't want to go too deep into detail, but there are validated ways. Now, just because they're validated ways doesn't mean it's easy, because you have to be trained in reading those reading those evaluations. And ultimately, we're thinking about professional identity formation. Where is this person on the spectrum of professional identity formation? And third-year medical students are often at near the beginning of it. And so some of it we all learn along the way, and very rarely are we kind of taught, you need to start thinking about somebody else rather than just yourself. That's a big transition for pre-clerkship to clerkship students oftentimes. And most of them get it. Sometimes they need a little more. Sometimes they're just a little bit longer, to metabolize that. And those narratives can be helpful.
And sorry, and then the last question, does time taken for remediation impact the learner's timeline to completing their program / graduation? I will say in kind of the residency context, it can, yes. And that's sort of determined by the program director, a clinical competency committee member and members, and sort of thinking about, whether somebody needs, a little bit more time and structured coaching and feedback before they can advance to their next postgraduate year, which can sort of inform whether a learner is going to be graduating on time or not.
Definitely true for clerkships as well. Some schools have moved up their clerkships to start, in April or in February or in January of, what otherwise would be the second year, which allows for more time on the back end for, not just professional development for everybody, but also shoring up things for remediation for students who need it. Because oftentimes, if a student is found to fail a clerkship, oftentimes they have to repeat it. And how do you make that repeating happen if they also want to keep on track for applying to residency programs without losing time? So there are very important considerations from that perspective as well, not to mention the financial implications. I know that there are some schools that for students who need more time, they foot the bill. I know that that's not possible for every single medical school. And so, really needing to balance what the needs of the student are, how deep the needs are, and what the resources are. I mean, this is the crux of remediation right now. Oftentimes, there are no resources. It's an afterthought. Remediation is an afterthought. And instead, institutions, organizations need to think about remediation as an indelible part of education. Everybody is going to struggle at some point. So how can we build that in to the resources that are necessary for all remediation programs? Online courses. I think, let's see, the one that I'm most familiar with would be the organization that all the book proceeds go to, and that's the Academy of Communication and Healthcare. Less for students, although students have definitely participated in the programs before. More so for practicing providers, veterinarians included, by the way, Katie. So that's, and maybe I would love to know in the chat. There may be others that I don't know about. So that would be. If there are resources, throw them into the chat. That would be great.
And I'm mindful of everybody's time, and we're at the top of the hour. Thank you all. It's sorry, concluding thoughts, Calvin?
No, somebody's asking for the name of the book, so I'm just going to put that in.
Oh, great.
I'll put it in for everybody. And it is available on Amazon, and I with any luck, the next one, Archana was one of the authors for the chapters for the upcoming books, and so we're really excited to help you all in this very, very important realm.
Excellent. Thank you guys very much for doing this, and the recording of this will be up on the website tomorrow. But we appreciate everybody participating, and the chat was going crazy today. So you guys did a great job. Thanks, everyone.
Good luck, everyone.